we go. Hey, Lindsay, how are you?
Doing well, thanks. How are you?
I'm great. I'm great. So I really appreciate you taking time out of your day to be with us and kind of tell us a little bit about your story and the journey that got you to see me and, now where you are. Where do we find you today? Are you at home in Alaska?
Yep, I'm in Anchorage, Alaska, and it's like 9 a.m. and my daughter's at school. I already went on like a good long walk with my dog, so just getting ready to start work after this.
Great. Is it getting cold up there already?
Yeah, it's officially fall. I like had to do my plants, get rid of them and take out all the pumpkins and things like that because we have
Uh-oh.
like a month and a half of fall before the snow comes.
Got it. Got it. All right. Well, I know you're super busy again, which is wonderful. But one of the first questions I ask people is if you think back to where you were when we first met in June, July of last year, tell me a little bit about if you can think back to, what your life was like at that time.
Well, it was very sad, but it was a lot of me just trying to convince myself that I wasn't so sad and that I was just very grateful. I had a crazy amount of rules about my life, which meant like no driving at night. I had to drink this much water. I had to do so much yoga. I had to do so much meditation, no
Mm,
social things. I had probably like 30 rules about my life that I was telling myself if I just followed these rules, then I would be able to be alive, not work, not take care of my daughter. Just that was just if I needed to live. And they sometimes those rules didn't work. I would still just have so much pain that I wouldn't be able to do anything. So,
yeah. And that was all to control your pain, just to try and get through the day and function. And that had been going on for quite some time by the time I met you, at least a few years, right? It was all after a fall. Yeah.
yes, I had two back-to-back TBIs, one
Mhm.
on the back and then one on the front.
Yeah.
Um, and never had headaches before that, and had a TBI that lasted like cognitive stuff for a few months, but then just the pain and the vision issues that I was having would not go away. So
And so let's talk a little bit very briefly, if you care to share, what were some of the things that you had tried? You talked to your doctors about this. The pain was pretty severe. What kinds of things had you tried before you came to see me?
um well, I think if it's all right, I think I am going to share my like little list just
Please.
because
Yeah.
okay, I am a person who I was like, this is something wrong. I need to get medical help. And I
Yeah.
went like Eastern medicine, Western medicine, and let's see, I did I saw general practitioners. I went to the ER a couple times, CT scans, X-rays, MRIs. I saw neurologists, I saw audiologists, I saw neuropsychologists, I saw an ophthalmologist, I saw an optometrist, I saw a neuro-ophthalmologist. I had prism lenses. I
Yeah.
did neural lenses. I went to an orthopedic surgeon. I did acupuncture with at least 6 or 7 different people. I saw 6 different chiropractors who were all national specializations in head injuries. I
Mm.
did physical therapy, specializing in concussion. I did exercise therapy and dry needling. I did Rolfing. I did occupational therapy, including matrix reprogramming and brain spotting. I did functional neurology. I did Atlas orthogonal chiropractic. I did craniosacral therapy. I did immersion tanks. I did massage therapy. I did red light therapy, TENS units, SSRIs, migraine medications, beta blockers, anti-anxiety medications. I saw a therapist, I saw a psychiatrist, I saw a psychologist. I did TBI group counseling. I saw an Ayurvedic counselor. I did yoga every day with daily meditation. I saw a dietitian, and I did gluten-free diet, sugar-free diet, keto diet, and then the brain save diet, each one for about 3 months. I went to a 2-week concussion treatment center in Canada. I did a program online called Concussion Compass, and I did the omega-3 protocol. So all of those things, none of them got me 10% better. And I would give them between 3 weeks and 3 months before I was like, that's enough. I've given my best to this. Now I need to move to something else. So it's a lot. I did a lot.
Yeah, that is literally one of the most comprehensive lists I've ever heard. And I've heard a lot.
It's
I
so
give you a lot of
much.
credit, and I'm only smiling because I think, I know this story has a little bit of a happy ending, which we'll get to soon, and because you're smiling as well. But I'm curious, with all of those things, did anyone ever say, "Hey, you might have occipital neuralgia, or this could be a nerve injury"?
Nope. At one point, the vagus nerve was brought up. And then I actually found you through concussion compass. A woman had been diagnosed with occipital neuralgia, and I talked to my doctor about it and then found you. But no, it sounds so bleak, but I did ask at one point, could this be nerve surgery? Because I've had a child and I'd had nerve pain then, and I thought that's what
Hmm.
I was having. And I was told, no, it couldn't possibly be
Yeah,
nerve surgery or
yeah.
nerve pain.
It's such an interesting thing because, and in fact, there's a recent article that I'm going to post about that just came out in our journals between a couple of great clinicians, a guy named Jeff Janis, who does some of this work in Ohio and has also published a little bit, is a good friend of mine, wonderful surgeon, wonderful human being. And then Pamela Blake, who's a neurologist, who is one of the believers, also a very well-known headache specialist. And it's really about how um, we as clinicians, between neurologists and plastic surgeons or whoever, peripheral nerve surgeons, are going to be treating this. I have been communicating with a surgeon who's now doing some of this. She's a neurosurgeon actually in Australia. And it's just great to see people taking this on. But the point was, how can we work together? Because when I hear stories like yourself, I think, and I hate to say it this way, but we really have a PR problem. In other words, not it's an awareness issue. Maybe PR sounds too commercial, but it's really the idea that no one out of all those people, nationally recognized specialists, would even consider this to be a nerve injury. If you've done the same thing in your hand and had this kind of sharp, hot, burning pain in your, you injured your forearm, you had this issue in your hand, anybody from across the room would say, "Hey, there's a nerve problem," and then you have to identify the nerve and do something with it. So, kind of moving through, we first actually met in person in July, and then shortly thereafter, you had surgery with me. We operated on 6 nerves in the back of the head, greater, lesser, third occipital nerves on both sides. Tell me a little bit about your surgical experience. What was it like, kind of going through that?
Well, I've only had surgery one other time, and I was like 9. So I had nothing to go with or base it on. But it wasn't so bad. I remember talking to you that night and being like, I'm doing great. And,
Yeah,
you know, I felt already a little bit different. I felt
mhm,
very groggy,
yeah,
and I now know that, anesthesia, I know what that means.
yeah,
So, maybe look that up if you've never experienced anesthesia.
yeah.
But no, I flew home 2 days later, and I just tied like a little scarf, like very gently around, and nobody even knew that I had surgery. I could, walk around fine, and I took it easy for, I think, like 6 weeks, like
Mhm, mhm.
just kind of laid low. But by Halloween, I went trick or treating in a giant inflatable T-Rex
Mhm.
costume. So, and that was only like 2 months later.
Yeah, yeah. Okay. Well, so it sounds like the surgical experience for you was pretty smooth sailing, sort of steady
Yeah.
improvement along the way, which is great. So cutting to the chase, we are, what is it, 13 months or so following your operation with me. Tell me a little bit what life is like now.
Well, it's like my husband says, it's night and day. Like it's completely different. I am really feeling just, well, and the effect was pretty immediate, not so much pain wise, because I was still kind of figuring things out, but like I will never forget a big thing of this was, I would say, like, if I could just get my vision back so I could use a
Mhm.
computer.
Yeah.
um about a week after we got back, so maybe like a week and a half after my surgery, we were driving and I could see all the signs, and I was like crying because I was just so grateful to be able to see. um and like, as a comparison, I couldn't go for hikes anymore. I go for hikes all the time now. It's not even something that I think about. That I used to not be able to walk around because the trees would freak me out because leaves move and
Yeah. Yeah.
freak me out. So like I couldn't handle it, and it was too much pain. And like another comparison is that I write for fun, like I used to be a writer,
Yeah.
and using a computer took me like 13 months to write one book when I was head injured. During my recovery, I wrote a book in 3 weeks. 3 weeks after my surgery, I wrote a second book in 3 weeks. And I go whole days without pain now. I do have pain in my jaw still, but that is not related. And it's kind of funny because I never would have even known that I had pain in my jaw because the
Mm.
pain over the top of my head and behind my eyes and in my neck was so bad that I didn't even feel this part. So, but yeah,
That's
I'm working. We're talking about having another kid. Like it's like I got my life back.
that's amazing. It's so wonderful to hear. It just warms my heart every time I hear stuff like that. Tell me about the books. What did you write and where can we find them? Are they published?
No, not yet. I'm looking for an agent. It's just kind of a new thing. I'm querying and stuff like that. And they're all kind of, I mean, psychological thriller, some feminist stuff, new
Okay.
takes on kind of old classics, things like that.
Sounds good. All right. Well, let us know where we can find them when you find an agent. And then we wanted to touch a little bit about the jaw pain. So tell me what's going on with that.
Um, well, so I was getting so much better and whole parts of the pain were going away.
Hmm.
But I think in January, I contacted your office and was like, I'm still having pain kind of like in this back area next to my ear. And you mentioned that a couple of things, but one of them was Eagle syndrome.
Hmm.
And I just, after kind of seeing doctors and trying things out, I was just diagnosed that I do have like a rare thing, Eagle syndrome, an extra growth of bone that my nerve has wrapped around. So, but I, again, like I never would have known.
Yeah, because your doctors, you told me when you went back and asked them about that, they were like, not possible.
Oh, they wanted to know who told me about it. Like it was a
Hmm.
secret.
Yeah.
Like how dare I, because I was like, well, what about Eagle syndrome? That was brought up with me. And they were like, who brought that up with you? It's like, Dr. Peled brought it up with me. Are you
Yeah.
gonna call him?
Yeah. Well, and they can always call, but again, it's really it reminds me of what one of my mentors at Harvard used to say. He says, "Zeeb, you have to be able to see what you're looking at." And when I hear stories about this, specific kind of pain and a specific, if you don't know that there's a nerve that kind of goes in that direction and that this is even a possibility, you won't know to ask the questions that may lead you down, non-conventional answer. I think there's also an adage in medicine when you hear hoofbeats, at least in the US, you think of horses, not zebras, right? I suppose if you lived in Kenya, you might say the opposite. But the point is, common things occur commonly. And yeah, Eagle syndrome is not very common. But at the same time, I think it's not as if, oh, I just had a little pain here and I think I have Eagle syndrome. It's been going on for a while and you've had a workup and no one can seem to find an answer. So, especially in this case, kind of like with the headache surgery, that the workup is really just an x-ray, right? And they see this very large bone and now you're going to go see someone to hopefully address that as well, like an ENT doctor, I think you said, right?
Yep. I got the nerve shot and it's just another nerve that,
Hmm. Yeah.
just another one. But yeah, in the meantime, it's such a, I would say it's like 15% of the pain that I used to have, where, I'll be driving and I'll be like, oh, that's
Yeah.
bad. But it's not
Well,
like, sorry, I can't go anywhere today
yeah.
because I can't get up.
Yeah. Well, listen, I know you're super busy. You got your whole life to get back to, which is fantastic. I'm going to give you the last word. Anything you want to kind of leave as a take home message?
Just that if you are considering this surgery to like, please talk to, Dr. Pellet or somebody who has experience with it, because I still talk to a lot of these, professionals that I used to see and work with who are nice people. I mean, I don't mean anything negative about them, but
Absolutely.
I tell them the surgery I got and they don't know what it is.
Yeah.
And they're like, tell me more. And also that just like everyone at your office has been so nice and like, you've been so nice. Like, it's just been the best medical experience of all of this. Aside from what happened, like me getting so much better, just I call your office and everybody still remembers me and is so great. So I just,
Oh,
please,
thank you.
if you're thinking about it, please actually look into it.
Yeah, I agree. I think that's a great message. I really appreciate all the kind words. I will certainly pass along your kind words to my staff. It's always great to hear that that's the case. And again, I just want to say thank you for telling us about what has happened, and I'm so happy to hear that you're doing so well. All right,
Thank
take
you.
care, and please let me know what those books are when you find a publisher, or however that works, because I'm going to buy them. So.
Oh, I will. I will. Thank you. That's very nice. I'm like, yeah, don't give up on anything.
Yeah, absolutely. All right. Well,
Thank
take
you so much.
care and be well.
Okay, bye.
Bye-bye.